Hey everybody, Justin Dunaway here with the Institute of Clinical Excellence. I am lead faculty for our spinal thrust manipulation and persistent pain comprehensive management seminars. Today I want to talk to you about meditation, rumination, and chronic pain. First, a quick shout out to all our volunteers that just returned from Haiti with Stand the Haiti Project. We had an awesome last 2 weeks down there. We saw about 1,700 patients. It was really exciting as we had the first class of Haitian PT students in their final year of PT school doing a clinical rotation, 10 of them through the clinic. So it was a really exciting, successful trip. So again, thanks to all the volunteers who came out, and again, very successful trip. All right, let's get into today's topic. There's a lot of talk about mindfulness, meditation, deep breathing techniques, and kind of their use in the chronic pain population. And for a lot of patients right off the bat, and some clinicians as well, it kind of feels a little bit woo-woo. It feels a little bit kind of outside of what we're trying to do, or it doesn't quite fit into our paradigms. So I want to talk a little bit about where these techniques fit in with our chronic pain population, and from a neuroplastic, neurophysiologic standpoint, how and why these things make sense. So when we think about chronic pain, when we think about transition from acute to chronic pain, when we think about worsening prognosis, increased pain intensity, when we think about transitioning from chronic pain to chronic widespread pain, a lot of these things seem to either be predicted by or correlate with high pain catastrophizing score scales. Right? And we can also see correlations with high PCS and some maladaptive neuroplastic changes. Lots of different regions in the brain seem to correlate with poor PCS scores, but one in particular is changes in hippocampal density in the hippocampus. And this seems to correlate with behavioral changes, with lack of fear extinction, with changes or alterations in pain memories and things like that. If you go onto PubMed and dump Apkarian, Apkarian, author name into there, you'll see a lot of really interesting work on some of these neuroplastic changes in persistent pain. And we talk a lot about these neuroplastic changes in our persistent pain course, but sort of a quick primer on how neuroplasticity works. And again, when we say neuroplasticity, what we're really talking about is our brains, or our nervous system's ability to change structure and function depending on stimulus, depending on the environment, depending on how these circuits are being used. And these things change due to focused repetition. Anything that you're doing regularly, whether it's a physical activity, whether it's a thought, whatever, anything that requires cortical activation through focused repetition, those circuits get stronger. And this idea came about a long time ago. Dr. Hebb gave us what was called the Hebbian theory, which is just simply put, an easy way to remember it is neurons that fire together, wire together. So through focused repetition, we create changes in brain density and brain functional connectivity, and these things make circuits more ingrained. They make circuits fire easier. Right? So if we step back and we look at how that relates to our persistent pain patients, and how that relates to pain catastrophizing scores in general, when we take our patients with persistent pain and we give them the PCS, what we find is that typically they score poorly, and there's kind of two subscales. You have there's three, but the two that we kind of focus on are pain magnification, and then there's quantification, or pain magnification, there's catastrophization, and then there's rumination. And you'll see the first two, they kind of fluctuate a little bit, but most of the persistent pain patients through the door, they bury the needle on the rumination subscale, right? 15 out of 15 on just about every patient I test with this. So when we think about what rumination is, it is a constant focus, a constant checking back in on your pain or on a negative emotion or on a thought in your brain, but you continually run that cycle over and over again. So our patients in persistent pain, they constantly check in on their pain. They're constantly checking in on their negative emotions, constantly checking in on their fears and their anxieties, ruminating on these things, running that circuit. And what Heb taught us is that when you run the circuit over and over again, you make that circuit stronger. You have functional connectivity changes, and you have changes in brain matter, brain density, brain morphology. So this goes back to some of those changes that Carrion talked to us about in the hippocampus and other areas of the brain, right? So the other thing that occurs when we constantly are running these negative emotions or constantly running these pain circuits, these are also stressors, right? So we have our stress response. We're essentially in a state of sympathetic overdrive. And if you look at patients in chronic pain and you look at their heart rate and their resting heart rate, we see increases in both of these. We also see large jumps in heart rate with very small perturbations in physical activity. And these all kind of relate to this sympathetic overdrive or HPA axis dysfunction, which can be a function of constantly running these stressful circuits, right? So that goes back to how do we shut this off? How do we change the equation? How do we get patients out of this rumination so that they stop running these maladaptive circuits to give these circuits a chance to reset? Well, the opposite of neuroplasticity is true as well, right? So nerves that fire together wire together. And another way to think about it is neurons out of sync fail to link, right? So all that means is that neuroplasticity is reversible. The more we use a thing, the stronger it gets. The less we use it, the weaker it gets. So we can separate these maladaptive circuits. So that brings us back to to mindfulness, to meditation. This is a very interesting and very powerful way to kind of shut these circuits off. And what this practice teaches us is it gets us to kind of sit in a quiet environment and sort of focus on where our brain is at and find ways to identify when our brain becomes distracted, identify when our brain shifts into thinking about our pain, a negative emotion, a negative experience, something fearful, something that creates anxiety, identify that, and then bring our brain back away from that. So essentially what it does is it takes a couple minutes out of the day and gets you to shut off your rumination, gets you to shut off that circuit and allowing those neurons to be out of sync for a few minutes. And maybe it breaks some of that linkage. It reverses some of that maladaptive neuroplasticity that drives rumination, that drives cortical changes in the brain, that drives a lot of the things that correlate with persistent pain. It gives us the opportunity to take our foot off the sympathetic gas pedal and shut down some of that stress response. So, with that being said, I've been very interested in this recently, and so I figured I would take some time and really focus on a meditation practice myself. And this is not something that I have historically done. So I decided to jump on the Headspace bandwagon, a really nice app. And you can do the first 10 days for free, and then it's a yearly membership that gives you access to all of their programs, and there's a lot of really cool stuff in there. But for about the last month and a half to almost 2 months now, I've picked a couple of their structured programs and spent 15 to 20 minutes a day doing a guided meditation. What's nice about the programs is they're kind of stacked. They sprinkle in a little bit of education with each piece. Each session builds off the last session. But really it teaches you how to focus on just what we were talking about, on that brain shift, on that distraction, or on that whatever that thing is in your brain that pulls your focus away from the moment. And it teaches you how to identify that and pull it back in. So over the last 45 or so days, a handful of things that I've learned personally about myself doing this. One is how often my mind is in 3 or 4 or 5 different places and not sitting in front of me. It's incredible how distracted I am and didn't even know it. And that's the surprising thing is once you sit down and start to do this, you really become aware of how distractible your brain is, or how often your brain gets pulled into something else other than the thing right in front of you. And over the last month and a half, I've really been focused on practicing to bring that back bring my mind back into focus. And what I've learned is that it's through focused repetition, it becomes more easy, and the brain becomes distracted less often. I'm just like half the ice staff. I'm a avid Whoop user, so I'm looking at my heart rate in real time and resting heart rate and sleep function and things like that. And what I've seen over the last month is that I've had significant changes in my resting heart rate. I've had changes in my heart rate variability. What's really interesting is that I've seen changes in my heart rate spikes as I'm going throughout the day, and I'll walk up the stairs, answer a phone call, something that slightly perturbs the system. Where my heart rate used to spike, the spikes are a lot less and a lot less frequent. I've also seen improvements in sleep, and I think the biggest thing for me is when I'm not doing the meditation practice, when I'm not doing that experience or the guided meditation at some point during the day, I find that throughout the day, I'm much more aware of when my brain becomes distracted. I'm much more aware of when I'm ruminating on something that happened earlier in the day or yesterday, or I'm focused on a project deadline coming up when I'm working on something completely different, and my brain is distracted by something stressful, and I'm running that stress circuit. And I'm much more aware of that, so I catch it, and I'm able to shift away from that much more readily than prior to any of this. So just from a personal N=1 standpoint, I found a huge value in practicing this and running that, or trying to break my own rumination habits. So we shift this into the clinical perspective. We think about our patients with persistent pain. You ask John how his day was, and he talks about his pain. And you ask him how work is, and he talks about his pain. And you ask him how things at home are going, and he talks about his pain. Patients in persistent pain is the whole function of pain is to capture your attention, to make you behave differently, to avoid a potentially damaging or threatful stimulus, right? So pain, the whole purpose of pain is to capture attention. Patients in persistent pain are stuck ruminating on this pain cycle, and that rumination of pain, from a neuroplastic standpoint, creates a system that is much more easily in pain. Right? So this is such a beautiful technique for getting our patients to just take a few minutes of the day and breaking that pain cycle, or breaking that ruminating on pain, ruminating on a stressful thing cycle. And if we can do that, we have the chance of reversing some of that maladaptive neuroplastic changes in the cortex, making it much easier for patients to disengage from their painful experience. So when we treat our patients, when we're working with our patients with persistent pain, and we've identified some of these ruminating behaviors, some of these patients that are their mindset is stuck in their pain, in their stress, in their anxiety, this becomes a very, very powerful tool. I talk to my patients about meditation. I talk to them about these apps. We do some mindfulness breathing techniques in the clinic to show them how powerful it is. You can put a patient on the table for 5 minutes, get them to close their eyes, and just talk them through some breathing exercises and get them to focus on some breath work. And that shifts their brain away from what they're thinking about. They can feel their heart rate slow down. They can feel their nervous system calm down. And a lot of times they get some buy-in right there. So on a personal note, I think there's value in instituting some form of daily meditation practice in all of our lives. But for our persistent pain patients, this becomes wildly important when we look to break some of these maladaptive neuroplastic changes and try to reverse some of the rumination that comes along with pain catastrophizing, because we know how much of a powerful link those things have to all of the negative things from pain to widespread pain to prognosis to transition from acute to chronic pain. So for those of you that are unfamiliar or haven't played with this stuff, much like I was, there's a lot of value in finding some free resources, jumping onto Headspace, whatever, but take 10 or 15 days and take 15 minutes a day and go through some of these guided meditations and just see if it makes you feel any different during the day. And then with that, introduce your patient to some of these practices. Show them how powerful this can be, and you're gonna see big changes in your patient population. Remember, with our persistent pain patients, this is not just bottom-up dysfunction. This is top-down stuff as well. We have to be addressing behavior and lifestyle, but we have to be addressing neuroplastic changes. And one of the things that drive that is rumination. Focused repetition of pain, of negative emotions, of anxieties, of fears. And this becomes a very, very powerful tool for breaking those cycles. So again, thank you guys for listening. The app that I'm using is Headspace, and I don't know if the sale's still there, but I found a Groupon that gave me half off for a year, so it was like $40 for 12 months of unlimited access. I highly suggest you checking it out. I'm in no way affiliated with Headspace, so you can check out any app. That's just the one I've been playing with. But I suggest you do it, and I suggest you start talking to your patients about some mindfulness meditation stuff and find ways to integrate that into your practice in the clinic. So again, thanks for listening. Hope you all have a great day.